My full name is Dr. Sanjeev Gupta, and I'm the specialty lead, and I work for the Royal Cornwall Hospital Trust. The average day, we usually come into the hospital at about 8 in the morning. We have a medical admissions unit, which is a sort of ward-based area. We have about 50 patients in 2 wards under us, and we do a quick round to find out what investigations have come and what the diagnosis is, what the treatment is, whether the patient still needs to be in hospital or whether we can get the patient home. There are lots of very bright young people who come into medical school, and by and large they're very focused and they know they want to, they've chosen a life of medicine. One of the things which becomes difficult for them is to then decide, well, what specialty do they want to go into? Do they want to become a hospital doctor and therefore become a consultant physician at some point, or do they want to remain in primary care and become a GP? And of course, there are loads of specialties in hospitals. So acute medicine or medical admissions, which I work in, or emergency medicine, are only 2 of them. But of course, you could become a chest physician, a cardiologist, a neurologist, so lots of options. I have always found acute medicine very rewarding. People might be variously ill and we don't always have a clue as to what is going on. We have to make some very quick decisions. We're always on our toes. That makes the job exciting, but also you realize that there's a lot of responsibility because wrong decisions can lead to disastrous consequences. I think Cornwall in itself is a brilliant place. It's very different from the place I grew up. So Cornwall is beautiful. I think it's a great place to bring up a family in. As far as acute medicine goes, I've always found it rewarding, and talking with people who are seriously unwell, patients are very grateful for what the hospitals and the hospital doctors and nurses do for them. I've always found it rewarding, and I have always managed to get away at the end of the day feeling that I've done a good day's job.